Hello everyone, I am Dr. Indrani Raman. I am the founder of Excel Health MD. Today we will be talking more about, oh, sorry guys, hold on. I am having some issues here. Yep. All right, today I wanted to talk about a really common question that I'm asked all the time in my clinic, especially when people visit us the first time and we talk all about the low carb diet and we give them the list of foods that they need to eat. And then they get really confused about the types, especially when it comes to fruits. And when we tell them to limit the amount of fruits and we tell them to limit certain vegetables like root vegetables, so then they're really confused about it. And then we go into all this discussion about simple carbohydrates and complex carbohydrates. So I thought that would be a great topic to discuss today. As you guys know, I'm Dr. Indrani Raman. I'm the founder of Excel Health MD. And on Tuesdays, I bring in front of you any topic or education about holistic weight loss. On Thursdays, we will be talking about functional wellness. So this is a really important topic, isn't it? Like when we hear so much in the media, and and I know there is all the low carbohydrate and keto diet is all the rage right now. And I know sometimes people get confused with simple sugars, complex sugars, and stuff. If you already know all of that stuff, then good for you and high five. Okay, but if you are somebody who still is not certain and not sure, especially about fructose or anything like that, then hang in there. I'm going to really clarify a few of the things here. My talk will be brief, maybe around maximum 10 minutes or so, where we will talk about all the types of sugars that are there in our diet and which may be beneficial for you and which you may need to avoid. So there you go. Carbohydrates are a source of energy. They are one of the three macronutrients in our diet, the carbs and protein and fats. Now, carbs are also called sugars. They are a type of compound also called as saccharides. So carbs can be divided into monosaccharides when there is only one sugar molecule, or disaccharide when it is two sugar molecules together. And that is your simple sugars. Now, complex carbs are again different groups, and when I come to that part, I will tell you what it means and how many sugar molecules they will have. So for now, let's talk about our monosaccharides and the disaccharides. The most common example of the monosaccharide, which is a simple sugar, is our glucose, and that's what we use. That is the most common way our body utilizes the carbs, and each gram of carbohydrate which is digested produces 4 calories of energy. And basically all the types of carbohydrates, when it comes to it, when they are broken down and metabolized into the body, they become glucose, and that's how it is transported and utilized by the cells. And insulin is a hormone that really helps the glucose to get into the cells, especially your muscle cells, and from there it is utilized by the cells for energy. So when you have issues with insulin, then all this glucose is not being entering the cells, and then that's when people get high blood sugar levels, and eventually first stage would be what we call insulin resistance and metabolic syndrome, and eventually they get type 2 diabetes from that. The glucose is most common, like present in all of our simple sugars, and excess amount of glucose is obviously not good for us, and that's how we get into trouble with type 2 diabetes and metabolic syndrome. The next monosaccharide or a simple sugar is fructose. Now, fructose is a sugar that is present in sugarcane. It's also present in a lot of fruits and berries and corn, and also beetroot. So it is the sweetest of all the simple sugars. In fact, did you know that your table sugar is a combination of fructose and also sucrose? So it's actually combined. Fructose is added into products so that they taste very sweet. And if you see in a lot of food products on the labels, they do add the high fructose corn syrup, because it is a preferred sweetener for all the processed foods because of its high amount of sweetness. Now, fructose is really not good for us, and this is a part I think a lot of people are not aware. We're all thinking we can eat a lot of fruits all the time, but eating a lot of fruits, especially if you have insulin resistance, is may not be good for you. The fructose, when it goes into the bloodstream, it's not metabolized the same way as glucose. It kind of is metabolized more in the liver, and you don't need insulin to metabolize this type of sugar. So it's metabolized in the liver, and excess fructose is stored as glycogen, and also it also increases a type of fat known as triglycerides. So if you have already fatty liver disease, you really don't want to consume too much of fructose because it may be harmful for you. And on top of it, it will also causes what is called de novo lipogenesis. What it means is it will increase the amount of fat production. So that is not good for you. So you're getting fatty liver, increased triglycerides, and overall, again, you may be getting into the picture of metabolic syndrome, and the metabolism of carbohydrate is all messed up at that time. So you are at more risk for diabetes. So excess amount of fructose is really not good for you. And if you're looking at the product labels, also try to avoid anywhere where it says high fructose corn syrup. And also, and this is why when you are doing low carb diet, you really need to avoid a lot of fruits. There are certain fruits, especially mangoes. I think I can give a great example. I know we all love to eat mangoes in summertime, but they do have a high amount of fructose. So if you already have any issues with fatty liver disease and such, so you need to really avoid fructose in your diet. Then I will talk about, sorry guys, I think I'm forgetting to put on my banners here. So that they are still simple sugars, which are the glucose and fructose. That's what I just talked about. And even still staying in the simple sugars, right? The disaccharides, which is two molecules of sugars together. The examples for that is lactose, which is most commonly in your milk, and it is also your sucrose, and maltose, which is in beer. And example of that is, of course, you need to avoid anything in a low carb diet. You want to avoid beer also, because you will be getting a high sugar load in the form of maltose. Even glycogen is also a type of a disaccharide, because you are forming multiple sugar molecules, and that's how we are storing energy in our body too. And obviously table sugar, we talked about, is also a disaccharide, which is sucrose. Sucrose is a disaccharide which is in table sugar, and like I said, often it is combined with fructose, so that you are getting the sweetness in it. And one of the things we talk about in the low carb diet is also milk sugars, right? Lactose is also a form of a carbohydrate, and when you are drinking, especially a skim milk, which has low in fat, you're getting a higher amount of carbohydrate absorption. So you really need to avoid that when you're doing a low carb diet. Better options to replace the dairy would be something like an almond milk or coconut milk will be better for you. Now coming to the complex carbohydrates. Yes. Coming to the complex carbohydrate, guys, the common complex carbohydrate is nothing but several sugar molecules kind of together. It can be ranging anywhere from, if it is between 3 to 9 sugar molecules together, they're called oligosaccharides, and if it is more than 9, then they're called polysaccharides. Or so oligosaccharides are very big molecules. It's hard for the body to digest, because we don't have the enzymes to digest them. And this is how sugar is usually stored in a lot of plants. Especially an example for oligosaccharides will be things like beans, and also all the legumes. So these are the complex carbohydrates, and they're also very slow to be digested, and most of it may not even be digested, and it comes out in our stools as bulk product. So this is not really raising our blood sugar that much, and it is actually the better form of sugar for us to take, which is a complex carbohydrate. In addition, the some of the examples of oligosaccharides can be things like inulin, which also is now considered a prebiotic, which is good, which helps, which has also has a food for our gut bacteria. So it's like a prebiotic. We are providing the good food for, which is beneficial. So we have healthy bacteria in our gut. So you really need to eat things which are more in complex carbohydrates. The other example is polysaccharides, which is like a large amounts of sugar molecule, thousands of sugar molecules together. For an example of that could be things like amylose and also amylopectin. These are all what's present as starches in grains and starchy tubers, which are all present in the food supply. Another example of oligosaccharide is what is a fructose oligosaccharide, which is also most commonly present in nature, and that's how sugar is stored in nature. The examples are bananas, your tomatoes, onion, and chicory, and artichokes. Those are all the common examples of fructose oligosaccharides, and these are really beneficial for our intestinal bacterial growth, and it also is useful to improve the lipid levels. And because there is no sugar spike, when we take that, the serum insulin levels is not raising, and it's really also, we are also increasing the fiber in our diet through this, so we're able to relieve constipation. Now, so these are also an example of the dietary fiber. So all of your polysaccharides and fructooligosaccharides are also an example of dietary fiber. In fact, dietary fiber by itself can be a whole separate topic. There's soluble and insoluble fiber in the dietary fiber. So I think I will make that as a separate topic on one of these days. One of the things when we talk about sugar, we also have to talk about the absorption part of it. So there's two concepts you need to understand when it comes to sugar. One is that glycemic index and glycemic load. Glycemic index means that when you eat, when you consume a carbohydrate, what effect it is having on your blood glucose levels. That is a glycemic index, and it depends on several factors. It depends on your amount of digestion, your metabolism, and the amount of carbohydrate. So, but the simple thing is you do want to eat things which are low glycemic index, right? So when you look at food products, you need to pick those which are low glycemic index. That means your sugar does not spike up too much. On top of it, you also want to eat, so for example, things which are high glycemic index is all your processed sugars, your table sugars, your donuts, all the white sugar, white bread. White bread is a very common example. Your spaghetti, all of those processed, the desserts, all of those things are all those things which have high glycemic index. So you really need to avoid those because you're going to spike your sugar very rapidly. The low glycemic index foods can be, for example, things like maybe oatmeal or anything with fiber mixed in it, like legumes and grains and some non-root vegetables. All of those things, even though they have carbs in them, they're very low glycemic index, so they're not raising your sugar levels that much. So low glycemic index foods are better for you. On top of it, you also have to think about the portion size with the glycemic index. So if you're eating, for example, a food which is low glycemic index, but if you consume too much of it, then you're increasing the sugar load, and that's what it's called, glycemic load. So you also have to be conscious of not only the glycemic index, but also how much of it you're eating. For example, the things like carrots have very high glycemic index, but when you eat it, you are not probably spiking that much because there may be natural form, there may be some fiber in it. But when you juice it, then you are really increasing the glycemic load because you are eating, you're not going to juice just one carrot, right? You're going to probably juice more carrots in there. So you're not only adding up on the load of it, so the portion size of it will raise your sugars too much. And same thing with fruit, right? When you eat fruit, we talked about the fructose, but when you eat fruit, you probably want to eat fruit as it is instead of juicing it, because your glycemic load really goes up when you juice a fruit compared to when you eat it. There may have be some natural fiber in it that will slow down the digestion, and maybe your sugar spike may not be that much worse with it. So I hope this has been useful to you guys. So if you think you're getting some education here, please like and subscribe our Facebook page, and also share it with your friends. And if you are interested in making an appointment with us, also go ahead and visit our website at excelhealthmd.com. I would be happy to talk to you and get you started on your own wellness journey. And we do, most of our clients are having great success doing a low carb diet. You can do this at any age and at any point of your life. And we also have several success stories where we are able to improve people with type 2 diabetes and even get them off medications. Now, I know there was a comment here. Ms. May Hernandez, thank you for participating and your comment. Yes, you're right. Sugar is even more addictive than drugs. There was a study done where they fed the rats sugar, and also they also gave them cocaine, it seems. So apparently, when time came for it, the rats preferred to have sugar rush rather than cocaine rush. So that's how much of a dopamine effect the sugar causes in your brain. So, and it can be very addictive. So that's why I think last time when I was talking about the hormones and those things, so that's one of the neurotransmitters in the brain, dopamine, which is a feel good chemical, gets stimulated quite a bit when you eat things with sugar, and that's why it's so hard to stop that addiction. And that's what we strive to work for in our practice here. So if this resonates with you guys, please like and subscribe our Facebook page, and I'll be happy to bring in front of you more topics every week. Every Tuesday, I talk about holistic weight loss, and on Thursdays, we'll be talking about functional wellness. Thank you very much. Have a great night.